All right, hi, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything's magnified about 40 times on the screen, and right away we can see there's a lot of arthritis. We can confirm that the rotator cuff's torn, the biceps tendon's torn. We need a pair of scissors, and the labrum is certainly torn as well. Hold the camera here for a second. So we're going to start with a shaver just to give me a little, just to clean up some of these torn areas so we can see a little bit better. But the main reason we're here, the rotator cuff tear, we're definitely going to be working on that. So we'll open up one of those anchors and get the straight and the turn to the right suture hooks ready to go and the shuttle relays. Okay, we're passing a spinal needle through the biceps tendon. We're going to try and do a bit of a biceps tenodesis. We may even use the biceps as part of our rotator cuff repair if we have to. But there you see the needle, there you see the black wire. We'll take a grasper. Sorry. And we'll grab the relay. Back the needle out. And then we're going to load that wire with a suture. Okay, there it is going there. We'll do the same thing with the relay one more time. Spinal needle first. Yep. Do you have the... So we're close. I like that, and we'll tell you why in a minute. We're going to go ahead and pass the relay through. And now we're going to reach around behind the biceps. Hold right there. There's two hands on it so you can hold steady maybe. There we go. That's almost all the way around. There we go. So now we're going to reach around the biceps and we'll retrieve the same relay. Okay, hold right here. Tough angle, but we'll keep working here. We'll show you some more in just a minute. Okay, now we're just cutting the remainder of the biceps attachment because we've got it secured. And now we'll put our shaver back in and get to work on debriding what's left of the labrum, and then we'll get to work on the rotator cuff tear. You can see some areas on the glenoid down below where the cartilage is completely missing, those yellow bare areas. That's where the arthritis has progressed to a point that there's no more cartilage. Hold this. Okay, so here's the tear in the tendon. As we rotate the shoulder, it becomes pretty obvious, so it's not attached there. You can see the bicep sutures up here to the right. The right side of the screen is the front of your shoulder. The left side of your screen is the back of your shoulder. So that tear is right in the middle. We're going to take a spinal needle because that'll help us identify the tear and help us plan where we're going to place our suture anchors. I'm going to start a little bit more back here. This is the posterior side. We can see the tendons attached way back here. But we're going to place our first anchor down someplace right about here, and probably another one up front. So hold the camera there. We'll make a little nick in the skin. We'll show you some more in a minute. Okay, so this is a guide for our anchor placement. We're just using this to identify the tear completely. We're just flushing this out. That's down into the joint. That gives us a pretty good look at the articular margin as well. So it looks like if we get pretty close to the margin and place our first anchor right here, that would be a pretty good spot. Go ahead and pull that and put the anchor in. Okay, so we've got an anchor in. It's got 3 separate sutures on it. When I pull on it, watch what happens. It pulls the entire humeral head, so that's good. That means you got a solid anchor. We're going to reach in from the front of your shoulder and start passing these sutures one at a time. Pull that out of the way. Pull the bicep sutures out of the way. And so we want the suture that's the most posterior here, which would be this blue and white one. Okay, so here's our suture hook. We'll push the camera past. Okay, so here's our suture hook. You can see the angle we're going to try and pass the suture in. This is the torn tendon here. It's important whenever possible to get that deep layer. So I'm just making sure that we have that deep layer captured by holding on to it. We're going to take our hook back. And then what you see is how that comes all the way underneath. You can see how that works. We'll load the relay. We'll put a left hand on that just to keep it from coming out. Go ahead and load that, Vern. And now we'll go ahead and load that black wire with the blue and white suture. You can see how the wire is still coming out there. You ready? And now we'll pull back on it. There it goes underneath, and there it comes out there. And so now we'll take our crochet hook. We'll reach in and we'll get the partner suture here. This is why they're color-coded, so we want the other blue and white suture. Which is right here. Okay. And that's going to be our first knot. When we tie that, it's going to hold things down just like that. Okay, so we've tied the first stitch. It's right back in here. You can just see the cut edge of it right there. And that's done a great job holding down the posterior part of this tear. Now we're going to use another suture hook. It's a 45-degree angled hook right here. And you can see our action here is going to be something like that to come through and come out right there. So we'll go ahead and rehearse the stitch. And we're going to place it right about here. So we're going to start here. We're going to come into the tendon right about here. Hold the camera. So here we are coming underneath. We'll go ahead and feed that wire. Hold the camera right there. And then once we have enough of this fed, we'll go ahead and retrieve it. Like that. We'll show you some more in a minute. Okay, so we've got 3 sutures going across the tear, and it looks good. That tear is completely sealed down. Our 3rd suture is that black and white one right there. 2nd one's right there. 1st one's right underneath that. And so you can see as I rotate your arm now, everything's moving solidly as one unit. And that's the way it's supposed to look. So these 2 sutures are not tied, as you see. These are the biceps tenodesis sutures, so we're going to retrieve these right now. And we'll tie these. These will be the last sutures we have to tie. Okay, so we've got the bicep suture tied here. Just to show you once again, ignore that punch for a minute, but just to show you once again, when I rotate the arm now, everything looks pretty solid. So we're going to leave today with knowing that rotator cuff's anchored down as one solid unit. We're going to do one more little trick here to help things heal. We're going to make a little hole in the greater tuberosity because it releases some of the bone marrow elements, proteins, and enzymes and things that are involved in the healing process. Even a few stem cells live in there. And with this size tear, if we can just maybe make a little hole right there. Go ahead. Okay. And that just goes down into the marrow space. And watch what happens as we turn down the pressure and start to drain things. We should see some of the marrow even start to come out. Yeah, there it is. You can see some of the marrow elements starting to come out. So that'll be involved in the healing process. All sorts of good stuff in that, believe it or not. And we're going to finish up here and get you back to the recovery room. Okay, so good luck to you now. Bye-bye.